Well, good afternoon, and thank you for joining us on this special edition of Let's Talk here on WIN TV. I'm Denise Rolark Barnes, publisher of the Washington Informer, and today we're diving into a crucial topic that affects our community deeply: maternal health, specifically the mental health of our Black mothers. Recent data from the Maternal Health Mental Health Leadership Alliance reveals a striking and troubling truth. Nearly 50% of Black mothers grapple with maternal mental health conditions. And that's a staggering statistic and one that should shake each of us to our core. It emphasizes the urgency for action, awareness, and support in our community. And that's where the Greater Washington Urban League steps in. And I am grateful to have joining me today Dr. Hanna Tessema, who's a Director of Health and Wellness at the Greater Washington Urban League. Dr. Tessema, welcome to Let's Talk.
Thank you so much. Thank you for having me.
Oh, it's a pleasure. And sadly, I mean, we're talking about a crucial problem, but at the same time, there are solutions. And so let's first, if we can dive in a little bit on that statistic that I mentioned, that nearly 50% of Black mothers experience maternal mental health conditions. What does that mean?
Yeah, it's a concerning figure, absolutely. When we say that nearly half of Black mothers are experiencing these types of challenges, we're talking about depression, we're talking about anxiety, we're talking about trauma that folks might be experiencing during pregnancy and after birth as well. And really, when we think about this, it's not an individual level problem that Black women are experiencing that others aren't. Really, it's a systemic problem. It's the result of chronic stress that Black women experience, Black people experience throughout the US. And that chronic stress sometimes is referred to as generational weathering. And it just refers to what that stress does to our body over time and to our mind over time. It affects us physically as well as mentally. And so Black women are really navigating structural racism as well as, access to quality care. The program that we're doing is really aiming to improve on some of these systemic challenges that women are facing that are leading to these high percentages of mental health challenges.
You mentioned a term that I have never heard before, and that's, what did you say, generational weathering?
Yeah.
What does that mean?
Generational weathering is a term that was coined in the 90s, actually at my alma mater, the University of Michigan. And at the University of Michigan in the 90s, there was a professor, well, at the time she was a student, Dr. Arlene Geronimus, and she really coined the term. And it started off in the pregnancy space where Black teens were having better health outcomes than older Black women that were having children. And it was confusing because in the 90s, there was a lot out there about, teen pregnancy being, the worst thing that could happen. And, all of these sort of narratives were out there. And yet we were still seeing better, or they were seeing better health outcomes for teen Black girls that were having babies than older people. And so what they discovered over time after doing the research is that they just hadn't gotten to the point of living long enough as a Black woman, they were only teens, to have experienced the level of chronic stress that happens over time that creates these kind of challenges for Black adults as they age. So that generational weathering is referring to over time, Black people, Black women in this case, are experiencing chronic stress, and it affects the body and it affects the mind. So that's really what generational weathering refers to, and it affects so many people.
And this 50% statistic that we're talking about, one, I always like to know kind of what that comparison is to other, if we're talking racial groups, to other racial groups. Is that a number that's on the increase or decrease? And because it seems as though women, period, are experiencing mental health, maternal mental health, because of all the reasons that you raised. And so are we disproportionately impacted?
Absolutely. Highest, among Black women compared to any other racial group. And mental health issues are leading the way, but not number one. Number one among Black women is really around cardiovascular issues, but mental health closely follows. So both are a serious issue.
So the program that you all have created, the perinatal mental health certification training, that's a mouthful. How does that impact what we're talking about?
So this is an opportunity for us to really get at some of those systemic problems that we raised earlier, and the training is really meant to build a workforce that can show up for Black families in the most meaningful ways possible. Because really, what we're seeing is mental health challenges continue to happen, yet we don't have the workforce or have certified Black wellness professionals that can address these challenges. And so those in the Black community are having to go to, providers from other communities, and really don't always feel understood or feel like their lived experience is respected or valued. And so we are creating a pipeline of Black wellness providers to be able to address those mental health challenges in the best ways possible. That's really the goal of this program, to be culturally responsive, culturally appropriate, and also to be certified and to really understand what those needs look like, how to recognize them, how to respond. And so Birthing Black, both the perinatal and the paternal pieces are addressing those.
And so what is the role of fathers in this? I mean, are they causing the stress? Are they experiencing their own stress? How are they managing their stress and the mother of their child's stress? How does this impact fathers?
I think a lot of times what we're seeing through our fatherhood programs that we do at the Greater Washington Urban League, as well as just in general, is we're hearing that fathers feel left out of the story when there's conversation about, childbirth and parenthood. Fathers are just kind of seen as an afterthought, or that they're left out. Even in the birthing room, some of the fathers that we work with say that they were ignored, or that they felt invisible because, the clinicians were talking only to the mother, and, it was as if they weren't even there. And so, and then we know in our society that oftentimes men are not given a space to really process their feelings and think through why they're experiencing the things they're experiencing, and how to talk through them, in a thoughtful way. And so I think that part is the biggest challenge that really sort of pushed us, was the impetus to us creating, a space that actually centers the dad, because their mental health matters too. Something that we share is that about 1 in 10 fathers experience depression or anxiety during this time, and that number goes up when their partner is also struggling. So this is something that we don't often discuss, and we need to. And oftentimes, the screenings aren't happening, and the fathers are just not considered. And so, my colleague and I, Ms. Kimberly Corbin, our Chief Administrative Financial Officer, and I last year attended a conference that focused on the paternal aspect of things. And so we really wanted to incorporate that into what we were doing so that fathers wouldn't continue to feel overlooked.
I know you probably can't answer this question, but it goes through my head. How did childbirth, right? Maybe it's always been complicated, but it sounds like it's really getting more complicated now because of all of the, the impacts that just things have on the mother and the father. But I mean, we've gone through a lot of this historically, right? But and maybe that's the question about the impact, because if there's this increased mental health crisis that mothers and dads may be going through, the consequences of that are what? Low birth rates. But what is the impact of it?
Well, it can result in many things. Some of that has to do with separation of families, where, fathers are oftentimes removed from the family household for many reasons, but mental health can be at the center of that. And so a lot of our programs are really focused on saving lives, reuniting families, and really helping to support the Black family unit overall, because these systemic issues result in, diminishing that structure. And that's very problematic for us as an organization.
And I can assume, and maybe I should not assume, that this even crosses economic, um, boundaries, that, it's not necessarily just, lower income people, but, all kinds of people, categories of folks who are impacted by this. Is that?
100%. I mean, imagine, going through these challenges, dealing with those systemic barriers, but then also the economic pressures. When we talk about dads and fathers, for example, the first thing people say is you got to be a provider, or just being a man is, you're supposed to be a provider. But what does that mean? And what people often mean is you need to be a financial provider. But there's so many other ways of, so many other types of provision. And what does that look like in terms of the love and support that you can provide your family? But you've got to feel whole first in order to be able to do that. And many within our communities are not there. And so that's why our programs focus so much on healing and wholeness.
I think that's, everybody needs a little bit of that someplace, just to get through life. And so the program, I want to go back to that again, the certification training. Are you recruiting?
So yes, we are. We are for the paternal piece, and so we just actually exceeded the numbers for Birthing Black for the perinatal piece. But we're doing this every year, so we want people to stay in touch with us. We want people to continue to be part of this movement alongside us. We also have a Facebook group called Birthing Black, where you can begin to connect with other people who have either been through the program or are interested in this particular issue, or have become certified and can share their experience, or share study groups, for example, for those that want to take the exam. But for the paternal event, which is happening June 17th and 18th, we are absolutely recruiting for that and looking for folks to join us. It's in collaboration with DC Health, as well as Generation DMV, who are mental health providers here in the DC area. And so absolutely, we're recruiting. Please do join us. We welcome everyone.
And who are you recruiting? What are the folks? Who are the folks you're recruiting?
We have had a really vast array, diverse group of people. We've had clinical providers, so that's OBGYNs, psychiatrists. We've had nurses that have been in our program, but also we've had non-clinical midwives as well. We've also had non-clinical providers like doulas. We've had grief coaches that have been part of it, counselors. We've had professors and students that are doing research. Some folks are really interested in changing the diagnostic tools, or making sure that the questions that are asked, in the research kind of are more culturally appropriate. And everyone's approaching it from a different angle. And I think that diversity in our participation has been really helpful. We've also had psychologists, other social workers, and all types of people that are interested in this topic, some that just have a personal interest, whether it's something that they experience themselves, these challenges are something they've experienced themselves, or, they've seen with their partner or family member. So it's a wide array, but we're really looking for Black wellness providers. And that's what I want to say, to make sure that everyone understands this is intended to build a pipeline of Black providers that are certified in mental health.
And once the providers have received the training, how do they find people to work with, to help? I mean, is there a place where folks go? And what's the connection between, the trainer, or the person who's been trained, or the provider, and the community?
So there are many different ways. Everyone is in a different space. Some are in academia, and so they're working with other students that may be interested in learning about these issues, or other researchers who have already published or are looking to publish in these areas. In other cases, people are in a clinical context, and so they've got their patient population there. And then there are also doulas. There are a group of doulas that work together. We actually can share information and resources around some of those doulas in the DC area that are looking for that clientele, or people that are interested in receiving those non-clinical support services that they offer. And so we also, in addition to providing this training in collaboration with Postpartum Support International, we also serve as a convener, of different groups that may not have otherwise come together, and so they can share ideas, be thought partners with each other in order to be that resource that the community needs.
I guess my question is, and then, I'll kind of close this up, but, I am not, but assume, I'm a 30-year-old woman who's pregnant and having some anxiety. I don't know why, but I am. And I noticed that my husband or my partner also, is going through some things. How do we connect with these individuals? I mean, are there questions when we go to the doctor that they'll ask, or how do you make how do they make the connection? How would I make the connection?
You're highlighting a really important systemic issue that we have, which is that there is no standardization of this process across all clinical, providers. So some physicians may ask these questions, some may not. Some, will dig deeper and ask the right questions. Others may not know to ask. And this is not an area that's really focused on in training as much as it should be or could be. And so that's what kind of opened this gap for the need for this type of education to happen. Not everyone asks the right questions, unfortunately. And so creating a workforce of, hundreds of Black wellness providers really creates what doesn't exist. That whole standardization creates hundreds of people who are out there to ask the right questions in the community. And that's what makes us so proud of this work.
So for those who are interested, how do they contact you at the Urban League, Dr. Tessema? What do they do?
So you can send us an email if that works best for you, blackwellness@gwul.org. Or you could go to our website, gwul.org, and you can see our Family Wellness Center houses all of the Birthing Black programs, as well as our Black Fatherhood Blueprint program. So please, feel free to check out our website, again, gwul.org. And for those of us that are interested in, talking to someone on the phone, want to hear directly from someone, you can give us a call at 202-450-2464.
Okay, we're going to do that one more time so we can get it up there on the screen and folks can see it. And even if they have questions, go ahead and give us the number one more time.
Yes, so the phone number is 202-450-2464, and that's for our Family Wellness Center at the Greater Washington Urban League.
Okay, and they can call even if they just they saw this interview and they still have more questions. They could call that number and get answers, correct?
Absolutely, yes. You'll reach one of our dad advocates, one of our case managers. You'll reach one of the directors. Someone will answer. So absolutely, please reach out to us there, or go to our website or send us an email.
Wonderful. Well, we may want to reach out to you a little later as we get closer to Father's Day to talk about some of the programming you've been doing with dads. And because, I see some movement happening here with fathers saying, we're in there. We want to be in there. We want folks to know that we're in there. So, we make a follow up, as like I said, as we get closer to Father's Day. But I want to thank you for being with us today.
Thank you. Thank you so much for having me. It's been an honor. Thank you.
All righty. Have a good one and good luck with the program.
Thank you. You too.
All right.
Thank you.
Okay.
Bye-bye.
Bye-bye.